Yep.
Neurological component, whether it be a growth in the head or a bleed, drugs or alcohol, big one.
Yep.
Possibly trauma.
Yep. Yeah, MICA 30. Any updates on the patient?
Michael has had 3 generalised seizures. He currently has a spontaneous respiratory of 18 with resetting and maintaining respiration.
Great, mate. We'll see you soon. Thank you.
So we give them oxygen because when they seize, they don't breathe. That's when they can get damage in their brain. And the brain needs that constant flow of oxygen. So alarm bells are ringing for us.
I'll bring the airway bag.
Hey, mate.
Hey, guys. Here you go.
This is Michael. 3 episodes of seizure activity, the last one at 19:55.
Yep.
We've admitted him a dazzling at the time, which caused his seizure to stop.
When we arrive, there's a level of chaos to the scene. The other paramedics are controlling things in regards to maintaining an airway on the patient and assisting his breathing. They've done a lot of work in a short period of time.
What's his name?
He's at Michael. Home respirations with BBM ventilations. We brought it back up to 100.
Perfect.
It's all right, mate. His girlfriend is outside and his parents are there.
Sure.
Parents are there. In the black dress is his mum.
Just find out anything leading up to this or what his day's been like.
And this would be very traumatic for the patient's parents and his girlfriend to see. Their fit, well relative has dropped and had seizure activity in front of them, and for all they know, he could be dying.
Just relax, buddy. My name's Paul. I'm from the ambulance.
Leave that on for me, Michael.
Emergency services.
I can't breathe properly.
Are you home alone? Okay.
Yes. I'm meant to be isolating.
A 20-year-old has called the Emergency Communications Centre in extreme distress and gagging for breath. She's currently waiting on results of a COVID test.
I'm scared.
Yeah, I understand that you're scared. You're doing a really good job and I'll be here right with you, okay?
Thank you.
RC139.
RC139. Who's been breathing from code 1? You'll be back to my response on the down channel.
139 received.
Steve and Jade are dispatched to support a MICA paramedic who's also en route.
Clear left.
Yeah?
Safe to proceed.
Thank you.
Breathing problems are probably the most serious thing that we can go to in the ambulance. So it's really important to get there quickly and find out what we're dealing with.
20-year-old female struggling to breathe. Patient is coughing a lot in the background.
Suspected COVID. Oh, poor doll.
So I had COVID earlier this year.
There's Micah there.
As COVID is showing all of us, it evolves very quickly. There were points that I thought maybe even I need to call an ambulance.
Knock, knock. It's just Steve and Jade.
Hi, Steve. Colin. This is Jade. Probable COVID.
Yeah.
She's coughing.
When we walk in, Jade's sitting on the ground. She's kind of using her whole body to take a breath in. And I'm worried about the sound that I can hear coming from her throat.
She's really heaving with her breathing and looks like she's in some strife.
38-year-old Michael was out for an ice cream with his girlfriend when he suddenly collapsed, having multiple seizures.
So young, fit, healthy, no drug use.
That's where we're at right now.
Cam speaks to Michael's girlfriend May and stepmum to see if they can shed more light on what happened.
I'm his partner.
Oh, okay. My name's Cam. What's your name?
I'm Debbie.
Hi, Debbie. Well, can you tell me about him?
To the bathroom.
Oh, sure.
So
What can
he's-
we tell me that they might not know already?
He's super healthy.
Sure.
He went for a run this afternoon.
No headaches or anything of late? No medications he takes? He's not allergic to anything? No. It hasn't seemed more confused or anything of late?
Just 2 minutes before it happened. And I asked him a question, which I already knew the answer to, and he gave the wrong answer. And I'm like, are you okay?
Yeah. Okay. Our plan is to continue to just support his airway and his blood pressure and heart rate for the moment. I want to reassure them that we're going to look after him. We're going to do everything we can to protect him. Leave me with it for a little while. I'm going to run my eyes over him, see what these guys are up to, and we'll keep you posted. He's been given some medication to sedate him to drop the seizure, but some people still wake up after that medication and after a seizure, and which is a bonus because they're able to wake up, sit up and protect their own airway. But he's not waking up. He's a really fit bloke, as you can see. He went for a run today, he hasn't had any complaints, nothing at all. He was talking and then just became vague off into the distance and boom, went down.
Michael, can you open your eyes, mate? Michael, open your eyes, mate.
And we're waiting for Michael to come back out of these seizures to normality, but it's just not happening. Yeah, so something really serious is going on in Michael's brain.
It's okay, mate. Let's get him in the truck.
So we need to get Michael moving because treatment for Michael on the floor of an ice cream shop in front of a host of people and family is quite distressing.
You go and set up. I've got enough hands here.
Okay.
We need to get him onto our stretcher and we need to get him into the back of our truck.
Tell me when you're ready, guys.
The plan at the moment is to put him in the truck and see how he goes. If he's still requiring assisted ventilation, we're going to paralyse him and put a breathing tube down, okay?
Just relax, Michael. Good man. Good man.
She was hyperventilating, which was exacerbating it when I arrived. So as she continues to breathe harder, obviously it makes it worse.
Steve and Jade are backing up MICA paramedic Cullen, who has made his initial assessment of 20-year-old patient Jade.
Jade's had COVID-type symptoms for the last couple of days, predominantly sore throat. Have you got paracetamol in your...
Yeah, mate, I've got some in my kit. The management plan for Jade at this point is give some paracetamol for her pain, but the elephant in the room is symptomatic COVID, so I'll be closely monitoring her vital signs, making sure that Jade doesn't get worse.
I'm just in the process of finishing assessment, but I think she's actually got some swelling around her vocal cords. She's got an respiratory stridor.
Jade is experiencing something we call a stridor, which is a narrowing of the upper airway. If her airway continues to narrow to a point where it closes over, she won't be able to breathe anymore.
Has she tested positive on a rat?
She's had a PCR awaiting results. Yeah. So the rat didn't work, did it?
It's negative.
Even though we suspect that what's going on has something potentially to do with COVID, we actually have to be really mindful to not kind of box ourselves in with that idea. So we need to get her to hospital quickly so they can figure out why this is happening. And hopefully she doesn't deteriorate in that process.
Have we got a wheelchair?
Yeah, Jade's getting her bed in a wheelchair.
It's the ambulance, buddy. Cough for me.
Dodsy and Cam are trying to save the life of their 38-year-old patient Michael, who fell to the floor of an ice cream shop having multiple seizures.
We can see that the patient's waking up a little bit, but he's not waking up properly. I'd say his brain is stunned because it's been starved of oxygen for a little while, so he's moving his body thinking, wake up, what's happening, I don't like this feeling, like trying to wake from a sleep, but you can't.
All right, let's start looking at moving, yeah?
While Dodsy gets ready to move Michael to the ambulance, Cam heads out first to get organised.
I start to prepare all of my airway equipment. I've also got to draw up all of the drugs. In case he deteriorates, we need drugs ready to sedate him, paralyse him and maintain blood pressure while we work on him.
Ready? Yep. Go. Awesome, good work. Let's go up. Lift up. And let's get to the car.
Michael's girlfriend May and stepmum Debbie are still coming to grips with what's happening tonight.
So one of the things I'm always very aware of is the emotional state of the family. So they're seeing their loved one in a really bad state.
Just relax, Michael. Just relax, mate.
It's okay for me, I'm treating Michael, but they don't understand what's happening with him, so this is a scary time for them.
All right.
Step coming up.
Ready? Step coming down now. Go, Mick. Go.
So the drug we used to stop the seizures is wearing off on Michael.
Okay, nice and easy.
Which means his agitation is starting to increase again, and he's very hard to control.
Hang on, Michael. Michael. Hang on, mate.
So a patient that is agitated can create a whole host of problems because with Michael thrashing about, he's increasing that pressure in his brain that could cause more damage.
Sorry, mate, I just want to get him settled. Michael, relax, mate. So let's put some ketamine on board.
He's just really
hypoxic.
Yeah. And this time we give him a medicine called ketamine to reduce that stimulus and sedate him a bit so we can manage him in the back of the ambulance.
Oh, man, he's... Hold on. Okay. It's just hard to hang on to him. Nice and easy, Michael. Nice and easy, mate. You settled?
Hey, Michael.
Just relax,
You're
Michael.
safe, mate. You're in an ambulance.
Just relax. Okay.
He's a big boy.
Absolutely he is.
So Michael's agitation and his irritability in this postictal phase has now gone on for way too long.
I think that we just need to RSI.
Let's do it. Done.
And the decision's made. We need to paralyse him and sedate him.
It's all good, mate.
You can give him another little bit.
You're doing really well, all right?
Steve and Jade are moving their 20-year-old suspected COVID patient out to the ambulance.
That's okay, but we're here now. We're here now, all right? Just deep breaths, because if you get upset, it's going to be harder to breathe. All right? Just relax, we're here now. I know, but we're here.
You're doing a good job.
Nice and slowly, Del.
You right with that?
Great name, Jade. I'm just going to put some stickers on you, okay?
Yeah. Like, my roommate's gone, but he was isolating not long ago, so I think I got it from him.
So whenever we go to someone who has respiratory symptoms, one of our main concerns is how long have they been going like that for? Someone who's been shallow breathing and had an elevated breath rate for some time could be moving down the pathway of becoming quite unwell.
Can I just listen to your back? If you can sit a little bit forward, you can hold up onto here.
I'm going to put your top up. Good girl. It's all right. I'm going to lean you back.
Is it causing you pain somewhere? Just tightening?
It's just...
Sit back.
Here we go. Here. Slowly. You're doing really well.
Okay.
And then that was straight.
You're okay? That's okay, you're doing excellent, mate, okay? I just want you to really concentrate on the sound of my voice, okay?
Jade's dad, Nathan, has just arrived at the scene.
Jade, your dad's here.
Yo.
They're taking you to the hospital?
Yeah.
You're doing real well.
Thank you.
All right, mate, we'll take good care of her. So what we're going to do is we're going to load up. I think we'll get moving, okay? I don't think there's much benefit in just sitting here. So we don't need to give you any medications. I think if anything changes, though, to the point where you're really struggling to breathe in and breathe out, then I'm going to become a bit more concerned, okay? All right. When did you notice the noise in your throat started getting worse?
Like, I was trying to cough a lot because I thought it was like... But because I kept coughing.
Yeah.
I was also upset because anyone who's...
And he's very strong.
Yeah.
His future, right now, depends on the skills of Dodsy and Cam to perform an emergency, rapid sequence intubation that will take over his breathing.
Michael, it's okay. He is seriously strong.
Okay. I need a size 8 tube.
Cam can take over your side, and you heard what he's going to do, so you'll probably Cam's airway man.
Ambulance Victoria was one of the first ambulance services in the world to do RSI in the pre-hospital setting. So this is something that gives people in Michael's situation the best opportunity to good outcome prior to hospital.
So what we do is give somebody medications to paralyse them and stop them breathing. He's going to be 100% reliant on us getting that breathing tube in the right hole and then ventilating him to keep him alive. So my plan is, I'm going to do a tube with a stylet in it.
Perfect.
And attempt for first pass.
Perfect.
If I'm unsuccessful, I'm going to move to X-blade with a bougie.
Okay.
And then worst case is plan 3. I'm going to use an SGA and ventilate him.
Okay.
Should I get into the situation where I can't oxygenate and can't ventilate the patient, we're in a crike situation where I cut a hole in the patient's neck and put a breathing tube in, and that is a nerve-wracking procedure.
So we've worked out that he's 100 kilo.
Oh, easy. Yep.
Righto.
That's right.
Thank you.
And it's taped to it. We give him a long-acting paralysing agent called rocuronium. What it does, it stops a person breathing. It means that they can't move, they can't scratch themselves, swallow, talk, anything. They're paralysed. I'm just going to swap seats with you, so I'll get you to stand up and go that way, and I'll sneak in here. Thanks, mate.
All right, let's just all take a little breath.
Okay.
All right, you tell me when we're happy, mate.
Okay, I'm happy to drop drugs.
Righto, so I'm going to kick off with 100 of ketamine.
Yep.
And then I'm going to give him 100 of rock.
Sure.
Okay?
Sure.
Can someone just scribe those for me?
With girlfriend May watching on from outside the ambulance,
100 of rock going on board now.
Michael is given the drug to paralyse him.
On board.
So we put the drugs on and we wait for the patient to stop breathing.
Okay. So right now, SAT's 97, 118 on 70, heart rate's 95 and sinus.
Alex, can I give you that? Thanks, mate.
Once Michael has stopped breathing, Cam has only moments to insert the tube.
Righto. Everybody, there's anatomical and structural differences within their airway. And you never know what challenges you might face. It's quite deep.
In the back of an ambulance, Dodsy and Cam have just medically paralysed Michael.
Alex, can I give you that to hold?
So they can insert a life-saving breathing tube down his throat. Girlfriend May can't bear to watch anymore and has taken a seat in front.
If all goes well, there's between 60 and 90 seconds that the patient's not breathing. But with what's happening within his body, he might chew through all of his oxygen stores and his oxygen levels might fall very quickly. Righto. I open his mouth and introduce a laryngoscope. Tongue. Which is a tool to sweep the tongue to see if I can distinguish between the breathing tube and the eating tube. I can see his epiglottis. It's quite deep. I've got a grade 1 view. I see his vocal cords, and that's where I need to pass the tube between to ensure that it goes into the lungs, and when we ventilate him, we're inflating the lungs with oxygen. Grade 1 view, sided pass go through the cords. Can you just pull the introducer back a little bit? Yep. I'm happy with that.
Happy?
Yep, that can come out. I've got confirmed waveform there.
Good work, Cam. Nice tube.
Is everybody okay?
Yep.
Can you just let his partner know that the procedure went well?
Splitting 111.
Thank you.
So we know his airway's safe. We've taken over his breathing. His numbers are all nice and relaxed now, but he's still not out of danger. We still need to get him to hospital quickly.
So,
all right,
someone can drive us, but let's get going.
Yep, let's roll.
Drive you guys.
Yep.
Cam and I both travelling in the back of the truck with Michael is indicative of how sick Michael actually is. So we're still on high alert until we get Michael to hospital.
So it's a really slow drive there, nice and easy, thanks.
Yep.
He's still not breathing himself, so I'm constantly going to squeeze the bag to do the job that his lungs would normally do, and I'm going to do that all the way to hospital.
So Michael's going to need things like blood tests. He's definitely going to need a CT of his brain, and that could lead to surgery within the next couple of hours, particularly if he has a tumour or an undiagnosed bleed.
I hope he's got a good prognosis. He's a young, fit, healthy man. I mean, it's a waiting game for the family now.
So whether or not something organic or he's got an undiagnosed bleed or an undiagnosed tumour or something going on in there, or I don't know what else I could point it at.
Hopefully, the surgeons get on it early. Whatever is in there gets out, and the treatment's good, and he gets to live a good life. He gets to perhaps marry his girlfriend and spend more time with his family and enjoy the life that everybody should.
I mean, all in all, you know, right place, right people.
And he was fighting pretty hard. You had to hold him down.
I was sweating. That was a serious wrestle. I haven't had a good wrestle like that for a long time, mate. But look, hopefully a good outcome for him and the family. You know, young.
Yeah.
Good work, mate. Good job.
Thanks, buddy.